welcome to Medical Dialogues. I'm Roshni Dal. Let's look at today's top headlines. Decrease in pass percentage, increase in competition. MBBS students, professors react to recent changes in passing marks. The National Medical Commission has recently introduced a new passing mark criteria for MBBS students in accordance with the Competency-Based Medical Education Regulations 2023. Under these updated guidelines, MBBS subjects with 2 papers now require a minimum of 50% aggregate marks to pass, but the qualifying marks to be declared a pass have been lowered to 40%. Given India's healthcare challenges, there is a growing need to expand the healthcare sector and produce more doctors. If a student scores 40 in the practical exam, they must score at least 60 to pass the subject. Theory exam papers are evaluated by 2 different examiners, with one providing a score of 61 and the other giving no less than 59 to reach an average of 60. Different individuals handle the totaling process and the average score determines the pass. Additionally, there is no provision for evaluation for this batch. Taking these factors into account, many believe the previous system was more favorable and the new guidelines may put students at a disadvantage. This change in pass mark criteria is likely to create confusion among MBBS students. Frequent alterations to the MBBS curriculum could significantly impact student performance, confidence, and ultimately affect the healthcare system standards in the country. CDSU raises alert on fake batch of DEFITELIO. In response to the discovery of fake DEFITELIO ATMG ml concentrate for infusion in India, the CDSCU has issued an advisory urging healthcare professionals to prescribe with caution and educate patients about reporting adverse reactions. This follows a WHO alert regarding counterfeit DEFITELIO found in India and Turkey distributed through unauthorized channels. DEFITELIO is used to treat severe hepatic veno-occlusive disease in hematopoietic stem cell transplantation. The WHO Global Surveillance and Monitoring System issued an alert for Europe and Southeast Asia. The legitimate manufacturer confirmed the counterfeit nature of the product. Doctors remove iron rod from 60-year-old's thigh. Surgeons at Stanley Government Medical College and Hospital have successfully extracted an iron rod that had penetrated the thigh of a 60-year-old construction worker. The worker resides near Chennai and has a partial vision impairment in one eye, fell from a height of 8 feet onto a beam with a protruding iron rod. His co-workers managed to cut the rod with a hacksaw blade before he was brought to the hospital around 11:30 a.m. on Thursday. Upon admission to the emergency apartment, a team of doctors led by Dr. Satya Priya, Dr. Shokan, Dr. Tiru Narayan, Dr. Bhavani and Dr. Mala decided to perform a surgical procedure under anesthesia to remove the rod. The surgery was conducted within 3 hours of the patient's admission to prevent further damage to the thigh muscles and the femur bone, which was dangerously close to major blood vessels and nerves in the lower limb. Remarkably, the rod was successfully removed without causing harm to these critical structures. After the surgery, a Doppler study was performed to confirm adequate blood flow in the patient's leg. Dr. P. Balaji, the hospital's dean, reported that the patient is currently recovering in the high dependency unit while receiving close monitoring and high-end antibiotic treatment. Tata Memorial Centreled project makes waves with promise to cut cancer drug cost by up to 99%. A groundbreaking pilot initiative in India led by the prestigious Tata Memorial Centre, a leading cancer hospital, has shown remarkable cost savings through the pooled purchasing of essential oncology and supportive care medications. A study detailing the feasibility of this pooled procurement method, which involves group negotiations and agreement on pricing, was published in a WHO bulletin in June. The authors of the study include doctors from Tata Memorial Centre, including Director C.S. Ramesh, as well as professionals from the Jawaharlal Institute of Postgraduate Medical Education and Research in Puducherry and the Zulekha Yenipoya Institute of Oncology in Yenipoya, among others. The project, conducted in 2019 and 2020, achieved substantial savings compared to both a predefined reserve price and the maximum retail price for 40 high-volume drugs used in cancer patient care. In collaboration with 23 hospitals from the NCG, a network of over 250 cancer centers in India catering to the majority of the nation's cancer patients, the project piloted pooled procurement to enhance the negotiation power for these medications. Dr. Pramesh explained that the project was initiated due to the scarcity of reliable suppliers for critical cancer drugs, particularly for smaller healthcare centers, and the exorbitant drug cost. Frequent shortages of essential medications were observed at several centers, and drug manufacturers often quoted inflated prices, which posed challenges to cancer hospitals outside major cities. Doctors remove 50 magnets out of 7-year-old intestine at Rainbow Children's Hospital. In a recent statement, Rainbow Children's Hospital in Vijayawada announced that their medical experts successfully saved the life of a 7-year-old child brought to the emergency room. The details are that the young boy had been experiencing severe abdominal pain and vomiting for 24 to 48 hours when his parents rushed him to the hospital. The hospital's emergency staff promptly attended to the child and consulted Dr. Vamsi Siva Rama Raju, a consultant pediatrician and neonatologist. Upon examinations and investigations, it was discovered that the child had ingested foreign objects. Retrospectively, the parents mentioned that the boy had been playing with a magnetic bolt in the past few days. Timely identification and intervention prevented the child from developing severe sepsis and a prolonged stay in the ICU. The child underwent emergency surgery, during which multiple bowel perforations in the small and large intestines were discovered. Approximately 50 small pearl-shaped magnets were removed with the assistance of C-arm X-ray. The perforations were repaired and a temporary ileostomy was performed. The child's recovery was swift and he spent a short time in the ICU. Ileostomy closure was carried out 2 months later. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.